Hi friends, today I will talk about anthropometry. First is a disclaimer. Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided here is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Anthropometry, as we know, is a science of obtaining systematic measurements of the human body. Here I will be discussing about the height, body mass index, mid-arm circumference measurements, skin fold thickness measurements. How to measure the length or the height? The recumbent length is measured using as an infantometer with a fixed headpiece and horizontal backboard and adjustable footpiece. The recorder supports the child's head while the examiner positions the feet and ensures that the head lies in Frankfurt horizontal plane. Standing height is an assessment of maximum vertical size. The stature measurement is collected on a person aged 2 years and older who are able to stand unassisted. Standing height is measured using a stadiometer with a fixed vertical backboard and adjustable headpiece. We have to instruct the person to stand with heels together, toes apart, at least at 60 degree angle. We have to check that back of the head, shoulder blades, buttocks and heels of the person, they make direct contact with the backboard. Coming to short stature, it is defined as height that is below 22.5th percentile or 2 or more standard deviation below the mean for age and gender for a given population. That is, height below 2.5% of the people of the same age and gender are 2 standard deviation below the average height for age and gender. A growth velocity is that is below 5th percentile for age and gender. It is called growth deceleration, that is less than 5 centimeter per year after the age of 5 years. Example is growth rate below 5% of the people for the same age and gender, and person with less than 2 inches or 5 centimeter per year after the age of 5. Dwarfism is defined as short stature for the age of the patient. Most common causes of dwarfism are familial, short stature and constitutional delay of growth and puberty. Various causes of short stature are constitutional, endocrine, genetic, skeletal and acquired in children. Constitutional or hereditary causes are seen in Gurkhas, African Pyjamis. Endocrine causes are creatine, that is ratio between the upper and lower segment is less than equal to 1 with mental retardation. Patients who are pituitary dwarf, that is short-limbed, normal intelligence but may be associated with infantilism. Froelich syndrome, patients who are obese, diabetes insipidus and hypogonadism is there in these patients, and patients with Cushing syndrome, they all have short stature. They may have short stature. Genetic causes are Turner syndrome, Noonan syndrome, Hurler syndrome, Markey syndrome, multiple lentiginous syndrome. Skeletal causes are Ellis Van Creveld syndrome, chondrodystrophic dysplasia, short arms and legs, achondroplasia, that is short and bow legs and arms, waddling gait, and patient with osteogenesis imperfecta. Acquired causes in children are seen in rickets and port spine. Coming to tall stature, when the height of an individual is far in excess of the average normal for the age and race, that is more than 2 standard deviation of the mean height, the individual is considered to be in a tall stature. Causes of tall stature are when tall stature with equal upper and lower segments or equal arm to span ratio. Here we see constitutional tall stature in pituitary giants, sexual precocity and thyrotoxicosis. Other causes, tall stature with unequal upper to lower segment ratio, the ratio less than 0.8 or arm span to height ratio of more than equal to 1.05. It is seen in Marfan syndrome, Homocystinuria, Klinefelter syndrome. Arm span is distance between the tips of the middle fingers of one hand to the other when held abducted in horizontal plane. The arm span to height ratio is normally equal to or less than 1.05. The causes of increased arm span to height ratio are seen in Klinefelter syndrome, Homocystinuria, Marfan syndrome, Sotos syndrome, Hypogonadism. The arm span ratio varies with age. At birth, the arm span is typically lesser than length by at least 2.5 cm, and in children 10 years of age in boys and 12 years of age in girls, the arm span exceeds the height. How do we measure upper segment and lower segment? The upper segment of the body is measured from the top of the head to pubic symphysis or pubic ramus, and the lower segment is measured from the pubic ramus to the floor. Clinical implication of the upper segment to lower segment ratio are: at birth the ratio is 1.7, at 3 years it is 1.33, at 5 years it is 1.17, at 10 years it is 1, and after 10 years it is less than 1. The causes of increased or decreased upper segment to lower segment ratio are: increased upper segment to lower segment ratio is seen in children with rickets, achondroplasia, Turner syndrome because of decreased limb length, and decreased upper segment to lower segment ratio is seen in Marfan syndrome because of increased limb length. Coming to skin fold thickness, how do we measure? Approximately half of the total amount of the fat tissue in the human body is located below the surface of skin. This makes it possible to predict the total body fat from the skin fold thickness with a relative high degree of accuracy using a simple two-compartmental method. This accuracy is confirmed by CT scan as well as ultrasonic and radiographic techniques which are used to measure subcutaneous fat. In general, when the measuring skin fold thickness, the assessor uses the forefinger and the thumb, grabs and lifts the subcutaneous tissue and skin from the underlying muscle. Then we have to place the pincer of the skin fold caliper, applying a constant pressure 2 cm below the fingers at a depth of 1 cm, and hold this position for 3 to 4 seconds. Take 3 measurements for accuracy and provide the actual skin fold thickness in millimeter. These are the various clippers which are used for assessing the skin fold thickness. Coming to tricep skin fold thickness, it is a measure of subcutaneous fat stored taken at midpoint of the posterior aspect of the humerus. It correlates closely with the percentage of the body fat and with the total body fat. Tricep skin fold thickness varies between 6 mm and 12 mm in lean individual and between 40 mm and 50 mm in obese individual. The subject should be standing with arms hanging loosely at the sides. We have to position behind the subject. To locate the tricep skin fold site, we have to locate the site previously marked for mid-arm circumference measurements. The triceps skin fold site is the posterior surface of the arm midway between the shoulder and the elbow. Using the forefinger and the thumb, we have to grasp and lift the subcutaneous tissue and skin 2 cm above tricep skin fold. We have to place the pincer of the skin fold caliper at the tricep skin fold at the depth of 1 cm. Coming to body mass index, it is calculated as weight in kg divided by height in meter squares. As per the WHO, the underweight is when BMI is less than 18.5, normal BMI is 18.5 to 24.9, and when it is 24 to 29.9, we consider the individual as overweight. And obese is when the BMI is more than equal to 30. Obesity grade 1 is when the BMI is between 30 and 40, and morbid obesity is when it is more than 40.1 to 50, and obesity 3 is when it is more than 50. And similarly, we have a criteria for southeastern countries also. Metabolic syndrome, National Cholesterol Education Program, Adult Treatment Plan 3, 2005 has given some essential criteria which varies little bit from WHO 1999 guidelines. The essential criteria are more than equal to three of the following: when the waist circumference is more than 90 cm in males and more than 80 cm in females. And in WHO criteria, it is more than two of the following: waist hip ratio 0.9 in males and 0.85 in females, and BMI less than or equal to 30. In National Cholesterol Education Program Adult Treatment Panel 3, we have to consider the glucose also, which is more than 100 milligram per deciliter, or patient is on treatment. Triglyceride more than 150 milligram per deciliter, or the patient is on treatment. High density lipoprotein less than 14 males and less than 15 females are on treatment. Hypertension when the blood pressure is more than 130/85 and or the patient is on the treatment. These are all criteria which out of which three are more need to be met to consider the patient in the metabolic syndrome. But as per WHO, we have to get only two out of all these, two or more out of these. Triglyceride more than 150 milligram per deciliter. HDL, the ratio is decreased, that is less than 35 for males and less than 40 for female, and blood pressure is more than equal to 140/90. Coming to waist hip ratio, waist circumference, we have to locate the narrowest point between the ribs and the iliac crest. Ensure that the tape measures at the same height around the waist. We have to measure and state the measurements correctly to nearest centimeter. 90 centimeter in adult male and more than equal to 80 centimeter adult female is considered having abdominal obesity for South Asians. Hip circumference, hip measurement is taken at the widest lateral extension of the hips. We have to ensure that tape measure is horizontal. We have to measure and state the measurements correctly to correct the nearest centimeter. Calculate waist hip ratio to the two decimal places. Clinical implications are 0.9 in male and more than 0.85 are criteria for metabolic syndrome for this waist hip ratio. Coming to mid-arm circumference, we have to locate the midpoint of the arm. Non-dominant arm elbow flexed at 90 with palm facing upward. The measurer, or we have to stand behind the subject and locate the lateral tip of the olecranon and most distal point of the olecranon process. We have to place the tape measuring so that it can passes between these two landmarks and mark the midpoint. We have to stand behind the subject and we have to palpate the lateral tip of the acromion and the most distal point of the olecranon process. Then we have to place the tape measure so that it passes between these two landmarks and mark the midpoint. The subject stands erect with the arms hanging freely at the bedside and the palms facing the thigh. We have to place the tape perpendicular to the long axis of the arm at the marked point and measure the circumference to the nearest millimeter and provide the actual mid-arm circumference in centimeter. The various difference in cut points abdominal obesity for Southeastern Asian and Europeans are: abdominal obesity in men. So for South Asians, the waist circumference more than equal to 290 centimeter is considered abdominal obesity. For Europeans, it is more than 102 centimeter. For women, it is more than 280 centimeter, and for Europeans, the waist circumference more than equal to 88 centimeter is obesity. Coming to the neck circumference, it is a simple and time-saving screening procedure. It could be used to identify overweight and obese population based on a plane as a horizontal or possible at just below the larynx, that is thyroid cartilage, and perpendicular to long axis of the neck. The tape line in front of the neck should be placed at the same height as the tape line in the back of the neck. So we have it is measured on a plane as a horizontal as possible at the point just below the larynx, that is thyroid cartilage, and perpendicular to the long axis of the neck, that is tape line in front of the neck, should be placed at the same height as the tape line in the back of the neck. Varies based on the population. Among South Asians, the neck circumference of more than 34.9 centimeter for men and more than 31.25 centimeter for women. They were the best predictors for identifying the metabolic syndrome. Coming to neck height ratio, neck length was measured as linear distance between the two easily recognizable and fixed bony points, the external occipital protuberance and spinous process of C7 vertebra, with the patient standing upright and the neck held in neutral position. Normal ratio of the neck to height is 1.13. It is called bird index. Short neck is an important feature of conditions like Turner syndrome, Noonan, Klippel-Feil, and mucopolysaccharidosis. Neck height ratio has also been suggested to be a measure of the upper body adiposity like neck circumference. Various other miscellaneous items. A significant weight loss is when more than 10% of the body weight is lost in 6 months or 5 kg or more in 1 month. Cachexia is complex metabolic syndrome associated with underlying illness, and it is characterized by loss of muscle with or without loss of fat mass. Emaciation is extreme weight loss and unnatural thinness due to loss of fatty adipose tissue beneath the skin and muscle throughout the body. Weight for age is general appreciation for nutrition status and for growth monitoring. Height for age is the measure of linear growth deficit or stunting, slow process used for community diagnosis. Weight for height and length, it is the measure of the weight deficit according to the length, measure of the wasting, and used for individual and community diagnosis. Just a few words about Marfan syndrome, its diagnostic criteria and features. It is also called modified Gent's criteria. In the absence of family history of Marfan syndrome, the presence of one of the following criteria is diagnostic for Marfan syndrome. First is the aortic criteria and ectopia lentis. Second is aortic criteria and a causal FBN1 mutation. Third is aortic criteria and a systemic score that is more than equal to 7. Fourth is ectopia lentis and a causal FBN1 mutation. Any of these four with the absence of family history is suggestive of Marfan syndrome. But when there is presence of family history of Marfan syndrome, the presence of any of the following criteria is diagnostic. That is ectopic lentis, systemic score more than equal to 7 points, and aortic criteria. What is aortic criteria? When the aortic diameter Z score is 22, above 20 years of old patient, Z score 23, below 20 years, and patients with aortic dissection. Systemic scoring more than equal to 7 indicates major systemic involvement, and the various systemic scores are wrist and thumb sign. It is given 3 points. Wrist or thumb sign, it is given 1 point. Pectus carinatum deformity, it is given 2 point. Pectus excavatum or chest asymmetry, it is given 1 point. Hind foot deformity, it is given 2 point. Plain pes planus, it is given 1 point. Pneumothorax, given 2 point. Dural ectasia, it is given 2 point. Protuso acetabuli, it is given 2 point. Reduced upper segment to lower segment ratio and increased arm span and height and no severe scoliosis, it is given 1 point. Scoliosis or thoracolumbar kyphosis, it is given 1 point. Reduced elbow extension, given 1 point. Facial feature, at least 3 of the following 5 feature, that is dolichocephaly, that is reduced cephalic index or head width and length ratio, an ophthalmos down slanting, palpebral fissure, malar hypoplasia, and retrognathia. All are these given 1 point. Skin striae given 1 point. Myopia more than 3 diopters given 1 point. Mitral valve prolapse all types of mitral valve prolapse is given 1 point. So when this systemic criteria is gives more than equal to 7 points, this is included in the criteria of diagnosing Marfan syndrome. These are the few pictures which suggest patients. These are the few pictures with the features suggestive of Marfan syndrome. We can see the fingers are long, arm span is more than height. Patients have normal wise but high arch palate. There is pectus excavatum is seen. Patients have mitral prolapse or aortic dissections. Uh, Albert Schweitzer has said, success is not the key to happiness. Happiness is the key to success. If you love what you are doing, you will be successful. With this, I conclude my today's topic. Thank you. Thank you very much. Keep learning.